anxiety score of the interventional group compared to the control group. We have the same result from the interventional group, a decreasing trend with a mean of 1.878 to 1.79. This further strengthens our qualitative result. Other most significant findings to mention includes the factors of preoperative anxiety. Most respondents verbalize concerns of family, cost of surgery, and outcome of surgery. The quantitative result, however, showed no significance of most factors, yet having devices such as pacemaker or under medication could contribute to higher anxiety. Also, in our qualitative data, the incidental theme of diversion of activity or attention and the conscious forgetting. We relate this with our result in Amsterdam Preoperative Anxiety and Information Scale, or PIES, where questions regarding anesthesia and the procedure has increased from pre to post test. Transcription from our sources points out that there is a gap in translation. Our assumption is that as the procedure approaches, patients with anxiety at a certain point would not like to talk about the procedure. For our conclusion and recommendation, the experience has cultivated a different perspective to the researchers. The results were cited to be different of those studies and reviews in utilizing artworks to decrease anxiety, which showed a significant result. Though the p-value of the interventional group relates no significance, as there may be other associated factors influencing the study which are beyond the scope of this research. The outcome in combining both groups may promote a decrease in patient anxiety. Furthermore, the interventional group of the total population of patients with anxiety shows a decrease in the trend of anxiety level. In this regard, the researchers feel the need to promote art therapy among preoperative patients. Although at this point of time, it is vital to undertake and examine further findings beyond the figures of the population concerned. The researchers recommend to explore the effects of art combined with other variables, especially technological advancement, for the future endeavors. Before we end this presentation, let me leave you with this quote by Linda Bloinheim and Romero Brito. I avoid general anxiety by focusing on the process of painting, not the end result. Art is too important not to share. These were the actual patient's artwork. Thank you for your time.
Thank you, presenters, for sharing your research study with us. Again, we would like to call on Mr. Fabreag and Mr. Ebahay to award them the Certificate of Appreciation, which reads, the Society of Cardiovascular Nurse Practitioners of the Philippines Incorporated would like to award the Certificate of Appreciation to Mr. Mark Augustus L. Fabriag, RN, MSN, in grateful recognition of his invaluable contribution as research presenter during the 21st SCVN PPI Annual Convention with a theme spanning the spectrum from prevention and management of cardiovascular diseases, given this 18th day of May in the year of our Lord 2022. Signed, Jesus Ferdinand B. Peralta, RN, Chairperson of SCVN PPI 21st Annual Convention, and Janine L. Comendador, RN DDM, President of SCVN PPI.
Another certificate is awarded to Sir Alexis D. Ibahay. The Certificate of Appreciation is awarded to Alexis D. Ibahay, RN, MN, DSCN, in grateful recognition of his invaluable contribution as research presenter during the 21st SCVN PPI Annual Convention with the theme spanning the spectrum from prevention and management of cardiovascular diseases, given this 18th day of May in the year of our Lord 2022. Signed, Jesus Ferdinand B. Peralta, RN, the chairperson of the SCVN PPI 21st Annual Convention, and Janine L. Comentador, RN, DDM, President of the SCVN PPI. Congratulations, sir. Before we continue, some important reminders. Ang evaluation link po natin will be sent or will be posted in our chat box later before we end the convention. And also yung mga certificates po natin, so certificate of attendance po will be sent through your email after answering po yung ating evaluation forms. Let's proceed. For the next part of the program, may we request Ms. Katrina Maika R. Colyong, member of the Scientific Committee of this convention, to give us the synthesis of the topics presented today.
Good afternoon, everyone. Today, we had the pleasure of listening to several lectures by our esteemed speakers. First off, okay. All right, sorry. Take 3. Good afternoon, everyone. It's good. Today, we had the pleasure of listening to several lectures by our esteemed speakers. First off, the keynote speaker, Mrs. Evelyn Diestra, shared a brief and important history of cardiology as a specialty in the Philippines and how it was introduced in the form of an organization called the PHA in 1952, followed by the establishment of the Philippine Heart Center in 1975. She was part of a group of cardiovascular nurses fresh from cardiovascular training in the US that share their expertise in various cardiac specialized units with the goal to pass on their knowledge and render the best quality care to patients with cardiovascular diseases. She enjoined us to revisit strategies, especially in this digital era, to focus on patient empowerment and engagement. Technology is a tool that can be optimized to reach cardiovascular patients and involve them in all aspects of their care, from prevention to rehabilitation. The first topic was delivered by Mr. Richard Irvin M. Bismonte, a cath lab nurse at the Mariano Marcos Memorial Hospital and Medical Center. We were given a glimpse of the truly significant and complex role a cardiac cath lab nurse fulfills and the competence required to become one. In their institution, we learned that nurses execute the different roles needed to smoothly run a catheterization lab. The hemodynamic nurse closely monitors the hemodynamic parameters of the patient currently under the needle. The scrub nurse works elbow to elbow alongside the doctors in the theater. The cardiovascular nurse technologist is in charge of equipment and the supply chain of all things required in a cath lab, while the circulating nurse makes sure the procedure is completed safely from start to end. Listening to Mr. Bismonte brought light to the technical and personal experiences of a cath lab nurse, the challenges they face, and the professional and personal fulfillment they achieve in their role. The second topic focused on GUCH, or grown-up congenital heart, and was delivered by Dr. Rachel Niñalga, one of our very own pediatric cardiologists from the Philippine Heart Center. In her lecture, we learned that GUCH is now more commonly referred to as adult congenital heart disease, or ACHD. CHD is a lifelong condition irrespective of initial treatment at childhood, and patients are at risk for complications such as heart failure and arrhythmias. Hence, lifelong specialized cardiac care is required. This is where ACHD centers come in. Unfortunately, true ACHD centers are few and far in between, especially in middle-income countries, and a specific and highly specialized requirements are needed to create one. We learn key concepts of ACHD, such as transition versus transfer. For example, disparities in the care of this population includes poor transition from child-centered to adolescent healthcare, and lack of appropriate transfer of care, which should be addressed because of the tendency of patients to drop out of active healthcare during this crucial time. And as nurses of the Heart Center, we do encounter a lot of these patients, and we refer to them as lost to follow-up patients, coming in only when they can no longer tolerate their symptoms. Hopefully, more ACHD or GUCH centers will be initiated across the country. Dr. Franz Sarmiento delivered the third topic entitled Beyond Grit, Embracing Clinical Pathway for the Prevention and Evaluation of Cardiovascular Disease. We learned that the Philippine Heart Center has been utilizing clinical pathways since 2012, or for over 10 years now, and this consistent practice is testament to its effectiveness. Pathways can be called different names, but has one important goal: to standardize patient care processes to improve patient care outcomes. It is a multidisciplinary enterprise guided by current evidence-based guidelines, and in the end, benefits both the patient and the institution. Cardiovascular disease, specifically ischemic heart disease, is the #1 killer disease across all age groups in the Philippines, and Dr. Sarmiento answered a resounding yes to the question, does the Philippines really need a clinical pathway for the evaluation and prevention of cardiovascular disease? This is because clinical pathways have the potential to help in curbing that statistic. The fourth topic by Mr. Ronnie Villarosa from the Cotabato Regional and Medical Center expounded on the ideal coronary care journey. We received a comprehensive talk about concepts of critical care and intensive patient care. Patient-focused approach, wherein it involves designing healthcare services around the needs of the patient, rather the opposite, meaning we, the providers, should adjust and cater to their needs instead of them adjusting their needs and expectations according to what is comfortable for us. Patient and family response, wherein the importance of clear, timely communication between the healthcare providers and the patient and family was highlighted. Benefits and challenges in coronary care nursing. Nurse managers were enjoined to strive to be true leaders, as the role can make or break their staff's ability to face the challenges in the coronary and critical care nursing. Being an effective motivator, being present and knowing their staff are factors that can help endure and even enjoy the nursing experience in these areas. Finally, 2 research topics were presented. The first one presented by Mr. Mark Fabreag of the Heart Center showed the usability of the STEP app, a structured electronic pamphlet intended to influence self-care activity outcomes of CABG patients. Through quasi-experimental method of research, it showed an excellent usability in terms of overall score and is recommended for use by the research group. The second research topic presented was on the effect of creative art and focus therapy, or CRAFT, on reducing anxiety level among preoperative patients. This quasi-experimental study showed that it may promote a decrease in the trend of anxiety, resulting to the recommendation to promote art therapy among preoperative patients. Simple, yet effective. That is the end of my synthesis. Thank you for listening. Good afternoon to all.
Thank you, Ms. Colyong, for giving us a comprehensive synthesis of the lectures. At this point, we will now open the floor for the business meeting. We would like to call again Ms. Janine El Comendador, our NDDM, to give us the President's report.
Good afternoon, everybody. I will be reporting.
Good afternoon, everybody. I will be reporting the accomplishment of the Society of Cardiovascular Nurse Practitioners of the Philippines Incorporated for the calendar year 2021. Last May 20 and 21 of 2021, the Society had its 20th annual convention with the theme Cardiovascular Nurses at the Heart of Healthcare Transformation. It also set a new board of directors after its election. The Society of the Cardiovascular Nurse Practitioners of the Philippines Incorporated envisions itself as the leading specialty organization committed in advancing cardiovascular nursing, upholding the highest standards of nursing practice. The organization is committed to advance the cardiovascular nursing practice through the application of standards, education, research, and linkages in order to promote the quality of cardiovascular health of the Filipino people. Its objectives are as follows: to promote application and development of cardiovascular nursing standards based on evidence-based practices, to institutionalize sustainable organizational support structure for nursing career progression. In February 27, 2022, the organization submitted the requirements to PRC, Board of Nursing, for the career progression of the specialty organization. Third objective is to provide quality education and training programs at par with global standards for cardiovascular nurse practitioners. On November 23, 2021, the renewal of accreditation as continuous professional development provider has been approved by the CPD Council of Nursing for the society. The healthcare system have experienced instability with the emergence of the COVID-19 virus. In August 23, the Philippine Heart Association Council on Cardiovascular Nursing, in collaboration with the Society of Cardiovascular Nurse Practitioner of the Philippines Incorporated, have conducted a webinar entitled The Heart of Resilient Leadership, Leading in Times of COVID-19 Crisis and Beyond, with its speaker, Dr. Gerardo S. Manso, the Deputy Executive Director and the ICP Commander of the Philippine Heart Center. Being at the forefront, us nurses have to consistently be a pillar of strength and act as support system, not only for our patients, but also to our very own colleagues. The constant stress of having to face this exhausting battle challenged our resilience. The society recognized the need to continuously adapt to these demands by familiarizing with the different coping strategies. Thus, the webinar last February 11, 2022, entitled Reframing the Psychological Well-Being of Cardiovascular Nurses During COVID-19 Pandemic Crisis, with a speaker, Mr. Michael U. Jimenez. An emphasis on the role of cardiovascular nurse practitioners in the cardiovascular disease prevention was also given through a talk last February 21, 2022 at the 47th PHC Medical Alumni Symposium during the Philippine Heart Center anniversary. For the fourth objective, to collaborate with local and international organizations for the promotions of the professional, social, and economic welfare of the cardiovascular nurse practitioners. The society have been invited by the Philippine Heart Association for a meeting on academy guidelines and advocacy last September 1, 2021, and have participated in a guidelines development seminar in October 2 of the same year. On February 6, 2022, we have updated the Scvnppi website as well as the Facebook page. And today, our 21st annual convention is being conducted with a theme spanning the spectrum from prevention and management of cardiovascular diseases through online platform. With the upcoming event in collaboration again with the Philippine Heart Association Council in Cardiovascular Nursing, there will be a, during the Philippine Heart Association Convention on May 24 to 27. The CV nursing session will be on the May 27, 2022 at Ballroom 2. This will be an online platform also. These are all the accomplishments of the society for the past year. I will now turn you over to Ms. Joyet Anef Mindoro for the Treasurer's Report.
Good afternoon, everyone. For the financial report of the Society of the Cardiovascular Nurse Practitioners of the Philippines Incorporated, for the membership account, as of January 2021, we received an amount of 1,338,054 pesos and 96 centavos. As of December 2021, after all the expenses have been deducted, the remaining balance is 1,318,667 pesos and 47 centavos. For the regular account, as of January 2021, we received an amount of 1,015,849 pesos and 22 centavos. As of December 2021, after all the expenses have been deducted, we have the remaining balance of 912,670 pesos and 60 centavos. For BDO account, as of January 2021, we received an amount of 11,618 pesos and 75 centavos. As of December 2021, we have the total amount of 77,460 pesos and 40 centavos. That's all for the Treasurer's report. Thank you.
If there are any clarifications on the President's and Treasurer's reports,
I move for the approval of the President and Treasurer's report.
I second the motion.
President's and the Treasurer's reports has been approved and seconded with no corrections. Thank you.
Again, thank you, Ma'am Janine, for your leadership and support of the society. And now we have come to the last part of our program. But before we part ways, we would like to call on the overall chairman for the organizing committee for the 21st Scvnppi convention, Mr. Jesus Ferdinand B. Peralta, RN, to give us his closing remarks.
Good afternoon. We had a great time together for the whole day of our convention. We have been nourished with brilliant lecturers and research presentations from the experts. I wish to thank all the lecturers who took time to prepare their very impressive lectures, which we had the privilege of listening to and to apply it in our own institution. I would like also to thank the Scvnppi officers and organizing committee for the time they have spent to make this convention possible. Thank you for your effort and commitment. Finally, thank you to all our generous sponsors for sharing your blessings to the organization. Once again, thank you very much and see you again next year.
Okay guys, before we end, meron pa tayong isang Kahoot game. Last na talaga to. Kasi marami nagkatanong ng evaluation link. Pero guys, last na talaga to. Kahoot game, meron pa tayong isang Kahoot game. So yung mga gustong bumawi from the first Kahoot game, this is your chance.
PRC number. Again, kindly enter your PRC number instead of your name so you will be able to join.
Again, yung ating prizes for the Kahoot game, ang ating first prize will receive 500 pesos via GCash.
The second top two will win 300. via GCash, and the top 3 will win 100 pesos via GCash.
Yes. And while waiting for our players, we would like to thank again our sponsors, B. Brown, IDS Medical Systems Philippines Incorporated,
Boston Scientific, Philcare Pharma,
Technomed, and LifeLink,
Terumo Cardiovascular, Medicotech Incorporated,
Lister Corporation, SVP Meditech Corporation.
last but not the least, East Lane Corporation.
Also, ito na siguro na yung chance natin para mag-thank you dun sa ating mga speakers, no? Very credible talaga sila. From Sir Bismonte to Dr. Ninyalga, to Dr. Sarmiento, to Sir Villarosa, and also yung ating B-Brown presenter na si Sir Francis. Maraming salamat po sa inyo for sharing your time with us and for imparting your knowledge po dito sa ating convention.
Yes, and also to our participants for staying with us the whole day.
Yes,
Thank
from 8
you.
o'clock until now.
Yes,
Thank you po sa inyo.
thank you. Okay. Again, kindly use your PRC number.
Yes, and just like last time or this morning, we need at least mga 100 players, no? Yan. Currently, meron tayong 58 players.
Pabilisan ulit.
Para makapag-register, just scan the QR code na makikita sa inyong mobile devices. And then log in using your PRC license numbers. Manalo kaya ulit yung mga winners kanina.
Kaya nga sobrang swerte
Bakit hindi na sila
nun, ha?
sumali?
Give chance to others daw po. Okay. Last 30 seconds for you to join.
Again, scan the QR code. No need to type your license number sa ating chat box. Yung QR code po, scan lang natin. And then, dyan na po yung ating Kahoot game.
Yes, you'll be redirected to our Kahoot game. The more, the merrier. 5 questions again. And yung top 3, yun yung makakauwi ng prizes. Okay, 77 participants. And counting. Last 20 seconds.
Again, reminder, yung ating pong evaluation link will be posted on our chat box later after po na ating Kahoot game and before po receiving your certificate of attendance, you need to pass or answer the evaluation form.
84. 10 seconds. Last 10 seconds. Okay, we have 85 participants.
Again, ang Kahoot game is pabilisan and tatamaan ng sagot.
Dapat tama at
Multiple choice
mabilis.
naman tayo. From A to Z. Dapat.
I guess that's it. We can now start the game.
Okay, let's start. First question. What is the main topic of Ma'am Diestro in her keynote address?
So, pahirap ng pahirap.
Mahirap na sa
Difficulty
tanong.
level.
Kung nakikinig talaga kayo kanina,
Yes.
is it resiliency,
Gender equality.
or empowerment? Last 10 seconds.
Type it. Your answers. Type in. Choose your answer.
Time is up. The correct answer is empowerment.
Only 33 got it right. So our top scorer is the one with PRC ID 815762.
Mabilis siya, mabilis.
Mabilis. Pwede pang humabol po. Next.
Next question. The factors influencing successful transition, except
Except.
positive attitude of pediatric provider toward transition, attending spiritual rituals, history of multiple cardiac surgery. Four, three, two, one. Time is up.
Time's up.
The correct answer is except attending
Spiritual rituals. 38 got it right.
Most of you got it right.
Do we have a new? We have a new top scorer. PRC ID 0783512. Pwede pang humabol. Three more
Three more
questions.
questions. Third question, the following are the importance of clinical pathway except improves use of medication and treatment, cost-effective treatment for patients, unlimited use of laboratory tests and procedures. Four,
Except.
three,
Two,
one.
one.
Time is up. Parang yung color blue. Yeah.
Ah.
Except unlimited use of laboratory
Wow.
tests and procedures.
Most got it right.
Mm.
Do you have a
Ay,
new?
nako, consistent siya.
Consistent.
Mabilis-bilis to.
Mabilis ang hahabulin. Si 0783512 pa rin.
Dapat pag-appear ng question, sagot agad.
Wag na mag-isip.
Wag na mag-isip.
Next
Don't
question.
overthink. Fourth question. What is the most missed or neglected in the treatment program of patients with hypertension?
What is the most missed or neglected?
In the treatment. Kahit ako napapaisip. 3,
2, 1.
Time is up. The correct answer is lifestyle modification.
So diet daw, friend.
Dahil daw medyo nakakatamad kasi. Sarap kumain.
Ooh, we have a new top
First
scorer.
placer, yeah.
0572301. So wag mawawala ng pag-asa. Pwede pa.
Baka ano yung connection ng internet.
Nawala.
Nawala yung connection.
Next.
Last question. Scvnppi 21st Convention theme spanning the spectrum from blank of cardiovascular diseases, prevention and management, promotion and management, prevention and treatment. 10 seconds.
Tongue twister. 5 seconds. Time's up.
The correct answer is prevention and management.
Wow, most got it right.
Sino kaya ang nanalo this
Who
time?
won? Ooh.
Third placer is 0396272.
Top 2 placer is 0578820.
And our first placer is 0572301. Congratulations to all winners.
And the instructions on how to claim your prize is on the chat box. Kindly message the Viber of the number to be posted in the chat box. Include a copy of your PRC ID.
Yes. Para ma-check talaga natin kung sa inyo nga yung license number niyan.
Yes. Congratulations to all the winners. And that concludes our convention for today. Thank you to all our participants, speakers, panel, presenters, and organizers, and also partners for today's program. Before we end, we would like to remind everyone to please answer the evaluation form. Please scan the QR code posted on the screen or click the link posted in the chat box. Your certificate of attendance will be sent through your email.
Yan ang hinihintay ng lahat.
Yes, the evaluation link.
Again, thank you delegates and participants.
Thank you for joining us and have a good day.
Have a good day. Good day, everyone. And while we still have time, we would like again to thank our sponsors. Again, B. Brown, IDS Medical Systems Philippines Incorporated,
Boston Scientific, Philcare Pharma, Technomed,
Technomed International Incorporated,
LifeLink, Terumo Cardiovascular,
Medical Tech Incorporated, Lister Corporation,
SVT Meditech Corporation, and Eastlane Corporation. Thank
thank you,
you.
sponsors.